Alrighty, so we've just finished your periodontal assessment, and I just kind of want to ask you a couple of questions to start out. Have you ever heard about periodontal disease before?
Yes, I have.
Okay, what do you know about the condition?
I don't really know a lot, but all I know is it involves your gums.
Have you ever been told that you have gums disease or periodontal disease before?
I have not.
Okay, so how important is it for you to keep your teeth?
Very.
Very important?
Yes, it is. I love my smile.
Okay, well, good. Well, periodontal disease is an infection in the mouth caused by a buildup of bacteria, which comes from plaque accumulation. When we get this plaque accumulation, the bacteria loves to stick to that area. And a lot of this is deep down into your pockets in the area between your tooth and your gum. And this starts to destroy the fibers and bone because your immune system tries to defend the body by removing the tooth where the infection is. So that's why we start to see these things start happening. So the other thing too with this disease is there's usually no pain associated. So a lot of patients won't even know that they have this condition. But some symptoms that you might just be able to see at home are bad breath, loose teeth, bleeding gums, longer looking teeth. Have you ever experienced any of these before?
No, I have not. Not that I know of.
Not that you know of?
Not to my knowledge.
Okay.
Maybe some bleeding in the gums here and there, but...
Okay. Well, I did, when I was doing your probing, there was quite a bit of bleeding going on. So, so I'm just going to kind of go through. I have this flip chart here that kind of just helps explain better what is going on in your mouth. So this is what healthy gum and tissues look like. So we see there's full bone here, all the way up to a nice peak. The gums are nice and pink and tight to the tooth. And then this here is what we call a periodontal probe. So it's basically just like a little measuring tape, and we put it in the area between your tooth and your gum down to the base of what we call the pocket here. And a healthy range that we like to see is between 1 and 3 millimeters. As you can see here, we're right at about 3. So then we go to an early stage of periodontitis, which this could also just be called gingivitis. We see just a little bit of bone loss. We're starting to see some loss of fiber attachment. The gums are red and swollen, and the probing depths are starting to be about 4 millimeters. Then we get to moderate periodontitis. So we're just seeing just a little bit worsening of these factors, more bone loss, more inflammation of the gums. And we also start to see some tartar buildup around the root of the tooth and the crown as well. And pocket depths are a little bit deeper, 6 millimeters about. And this is the stage that you are currently in. This is advanced periodontitis. So lots of bone loss here, pretty severe, pretty inflamed, lots of red gums, millimeters up to 9 on that pocket. Oh gosh. And lots of tartar. So the thing about this stage that you're in is a lot of this is reversible. We can remove all of this tartar. We can clean out this area and hopefully get this inflammation down, your gums looking back to normal. But the bone loss is something that it will never grow back on its own. So what we're really trying to do is maintain the level that you're at. We don't want this to get any worse, because if it does and this keeps going down dramatically, you could eventually lose some of these teeth where we're seeing this advanced bone loss. So what we're going to try to do is prevent that from happening. So some factors that might get you to this stage. The first thing is you do have a history of tobacco use, And that is the number one risk factor for periodontal disease.
Okay.
So that's probably a huge factor here. Some of the medications you're taking could play a factor. And also you have an irregular, you've been seeing the dentist irregularly,
Yep.
so that could also be a factor. And then your home care as well could be increased. That could also be a factor. And then also something to think about too is you do have pre-hypertension.
Okay.
And so if we don't treat your periodontal condition, that can actually worsen the hypertension. So just a little bit of a incentive even more to get this taken care of.
And what is pre-hypertension?
You have elevated blood pressure and it's
Oh,
uncontrolled
okay.
right now. So
Wow.
yes. So
And what if I don't want to stop smoking?
well, then if you don't quit smoking, the prognosis of our treatments are not going to be as good. So if you quit smoking, we're going to see a lot better of results. So, I mean, if it's very important for you to keep your teeth, this is something that I probably would consider. And we have pamphlets that I can give you, and I can refer you if you want to do some smoking cessation counseling. And we can talk about that some more. So just some factors to give you a little more idea of why you're in this category is, you know, like I said, that bleeding when we were probing, you already have some missing teeth, you have some mobile teeth a little bit, and then on your x-rays we were seeing some of that bone loss that we were talking about, and then again just that tartar buildup. So what we can do is what we call non-surgical periodontal therapy. So what we'll do for that is it'll be 2 separate appointments. That they'll be 4 hours each.
Mm-hmm.
The reason why they're so long is like in this picture I showed you, like the tartar is going, you know, pretty far down the root of your tooth. So instead of just cleaning up here, we also have to clean way down in here. So that's why the appointments will take longer. And we split it up into 2 appointments because we numb the whole side of your mouth. We don't want both sides of the mouth numb, so then at least you can chew on one side of your mouth and things like that. So we'll use the local anesthetic for that, just to keep you more comfortable during the therapy, and just makes our work a little more efficient as well.
Is it necessary for me to use the local anesthesia?
We highly recommend it.
Okay.
Just makes things go a lot smoother. Just keeps you a lot more comfortable during the process. And so, yeah, it's just important for us to do this because your pockets are so deep that a regular toothbrush can't clean way down in there anymore. A regular dental visit, we usually don't clean way down in there. So, and then also we'll place a product that we have here in the clinic called Arrestin. And so after we get everything all cleaned out, your pockets that are a little bit deeper, we'll place this product. It just comes from a little plastic tip. We'll put it right in between the tooth and gum, place a little bit of powder in there, and then it stays in there over an extended period of time. And over time, it keeps releasing an antibiotic and just helps keep this area clean, helps fight the infection more. And the nice thing is this is free at our clinic, which
Really?
most it is not. So it's really nice to get that done here. I'm going to want to be putting it on 8 of your teeth. They're all in the back. So you'll have to be careful when flossing that area for a few days after because you don't want to disrupt the rest and you want it to stay in there as long as possible.
Is there any foods I should stay away from?
Yes. So things like popcorn with kernels and chips and crunchy foods that can get stuck down in there, especially where the Arrestin's placed. But even just after we do this procedure, because your tissues might be just a little bit irritated for a couple of days. So just careful, you know, real soft brushing, avoid those hard crunchy foods. And then in 4 to 6 weeks, we'll do a tissue check. You'll come back in, we'll reprobe, take some x-rays, do another evaluation, and what we're hoping to see is decreased probing depths, maintain bone levels. Hopefully none of those are going down anymore, reduced gum inflammation and bleeding. And if any of your pockets are still at about 6 millimeters or above, this is where we're probably likely to refer you to a periodontist, which this is where they perform more surgical procedures. They can do bone grafting, replace the bone where you have that extensive bone loss, which can help keep things healthy, get the tissues more attached to the gum. We just see really good prognosis with this. And then from there on out, we'll be putting you on 3-month recall appointments. And why we want to see you so frequently is just to really keep things healthy, maintain the work that we've done. We don't want to go too long because the bacteria can reaccumulate really quickly in those deeper pockets. So we just want to try to keep ahead of it, see you every 3 months. And then
Besides the local anesthesia, when I'm during the operation, is there any medications I can take like at home to help suppress the pain?
Yes. So at home, after your treatment, you can take anything over the counter, Advil, Tylenol, just what you would take regularly for pain. And then also you can do a salt water rinse a few times a day, just a couple tablespoons of salt in the warm water, rinse real lightly again, just, not super aggressively to disrupt that arrestin or do any damage there. So just softly do that. And then that should you shouldn't have super crazy pain, but just a little maybe discomfort. So just for a few days, really. And then also it's really important for you to increase your home care. So we're only going to be seeing you every 3 months and you're at home every day. This is where it's really important, like where, brushing your teeth twice a day. I would recommend getting an electric toothbrush or just a soft bristle toothbrush, no hard bristle brushes, and using a anti-tartar toothpaste, and then flossing every day. And if you're not huge on the traditional flossing, we can go over we have different products in the clinic I can show you, interdental brushes, things that make it a little easier. So we can go over those with you. And then also using a mouth rinse twice a day too can help keep that area nice and clean. So it'll be really important, I want to stress, really important for you. If you want to keep your teeth nice and healthy, it'll be great for you to be doing all of that. So do you have any other questions for me?
No, that about does it. I really appreciate your help today.
Okay, sounds good. We'll get your next appointment all set up for you then.
Awesome. Thank you.